What if I told you that 3,000 years before we even had a concept of modern medicine, surgeons were performing complex operations with tools that look, well, shockingly familiar? Let's start with prosthetics. In a tomb near Thebes, archaeologists found a mummy with a prosthetic big toe, expertly crafted from wood and leather from as early as 950 BCE. This wasn't just for looks. Clear wear and tear patterns on the toe prove it was used constantly, both barefoot and in their sandals. Biomechanical analysis confirmed this prosthetic would have let its owner walk around comfortably. This makes it the world's oldest known functional prosthetic limb, made not just to make the body whole for the afterlife, but to actually work in this life. And this is where the story gets even crazier. There's some emerging, tantalizing evidence from skulls over 4,000 years old that shows something incredible: potential cut marks made around cancerous growths. This suggests that ancient surgeons may have not only been able to identify cancer, but were perhaps attempting to surgically remove tumors from the skull. While it's presented as a hypothesis, and we don't know if this was done to treat living patients or for post-mortem study, the mere idea that they might have tried to intervene in a disease as complex as cancer is staggering. It could push back the timeline for the study of oncology by millennia. They also practiced a form of dentistry, treating toothaches and draining painful dental abscesses. And while the idea of drilling into the skull, a procedure called trepanation, is often linked with bizarre rituals, the Egyptians saw it with a surgeon's eye. The Edwin Smith Papyrus describes using a tool to drill into the skull, not for magic, but to relieve pressure on the brain after a head injury. Okay, but what about the two biggest hurdles for any ancient surgeon: pain and infection? An operation is pretty pointless if the patient dies from shock or a nasty infection a week later. The Egyptians had surprisingly effective answers for both. They knew how to manage pain. Lists recipes made from the poppy plant. They didn't have general anesthesia, but they did have a powerful toolkit of natural sedatives and painkillers. The Ebers Papyrus, another major medical text. Yep, the source of opium and extracts from the mandrake fruit, which were likely used to dull the agony during procedures. Even more impressive was their handle on infection. Long before anyone knew what germs were, they understood that clean wounds healed better. They routinely washed wounds and applied natural antiseptics. They used honey, which we now know has powerful antibacterial properties, directly on wounds to stop infection. They would also use willow bark, a natural source of salicylic acid, the active ingredient in aspirin, to cut down on inflammation and pain. They were effective treatments passed down for generations. They even sometimes applied moldy bread to infected wounds, which some see as a primitive forerunner to penicillin. These weren't lucky guesses. Now, it would be a mistake to try and pull the science and the spiritual completely apart in ancient Egypt. For them, the two were woven together. A physician was often also a priest, and healing was a holistic process for both the body and the soul. They believed sickness could be caused by supernatural forces, like an evil spirit blocking the body's natural channels. So while a surgeon would physically stitch a wound closed, the evidence is overwhelming. A resounding yes. With a toolkit of scalpels, forceps, and sutures, they performed procedures that wouldn't be equaled for more than 1,000 years. Guided by the rational genius of texts like the Edwin Smith Papyrus, they diagnosed injuries with incredible clarity. They built functional prosthetics, treated complex fractures, and may have even tried to remove cancerous tumors. They managed pain and fought infection with a sophisticated knowledge of natural medicine. They set the bone with a splint, eased the pain with a drug. They were pioneers of medical science who laid a foundation that would influence Greek and Roman medicine for centuries. And if you enjoyed this deep dive into ancient tech, make sure you like this video and hit subscribe for more adventures into the incredible history of human ingenuity. Thanks for watching. They prove that human brilliance is not just a modern invention. And it makes you wonder, what other forgotten knowledge is still out there, just waiting for us to rediscover? Protected the wound with an antiseptic and soothed the spirit with a prayer. It was the ultimate combination of practical medicine and psychological care, a deep understanding that the mind and body had to heal together. They'd also recite an incantation to drive off the evil that caused it in the first place. A prescription for a pain-killing herb might come with a specific spell to make it work even better. But instead of seeing this as a contradiction, we should see it as a complete approach to wellness. They were treating the whole person, So, was ancient Egyptian surgery insanely advanced? The surgeons of the Nile weren't primitive witch doctors. What do you think is the most impressive part of Egyptian surgery? Drop a comment below and let me know.